Hi everyone, and welcome back to our webinar series. My name's Hayley Green, and I'm a research assistant at Autistica. I'll be the Autistica host for today's webinar, and I'll be joined by Dr. Calum Hartley from Lancaster University, who will be discussing his work on how autistic children learn words. For those of you who are new to us, Autistica is the UK's leading autism research charity, and we exist to create breakthroughs that enable all autistic people to live happier, healthier, longer lives. We work with autistic people, fund research, and shape policy to make sure the evidence generated through research has real-world impact. A big part of that is sharing the latest research and evidence-based practice, which is what these webinars are all about. I'm really excited to be hosting this webinar today. As an autistic person myself, I had speech and language therapy as a child, and I am eager to find out what Calum has to share today. And so, to our main event, I'm delighted to hand over the webinar to Dr. Calum Hartley.
Thank you, Hayley. I'm at work today because I have a cat at home who I know would certainly disrupt this. So I'm in the office so he doesn't disturb us. Thanks to everyone for tuning in to this webinar. My name's Calum. I'm a senior lecturer in the psychology department at Lancaster University. And thanks to Autistica for giving me the opportunity today to talk to you all about how autistic children learn words. So a bit of background, I suppose, about our research team at Lancaster. There's quite a few of us here who are really interested in investigating how children learn language. And the focus of my particular team is on autism. And we have several overarching objectives that inform our research. Everything we do really is geared towards understanding how autistic children acquire vocabulary. We seek to document their strengths and identify ways of optimizing the presentation of audio and visual stimuli to appeal to their strengths. So to kind of improve or enhance scaffolding of novel word learning. Because of course, the more we know about how autistic children learn words, the better we are able to support them. Now, I'm really, really lucky to have, fantastic colleagues in this endeavor. We've got 4 wonderful PhD students who are actively researching this topic. We've got Cheriece, Sophie, Charlotte, and Leigh, and I'm going to be talking about some of their studies that they've conducted as part of their doctoral research. I need to thank Laura Bird, who was a research assistant on an ESRC grant that really got a lot of this research off the ground to begin with. And my academic colleagues, Padraig Monaghan and Gert Westerman, who work with me both on kind of grant projects, but also in co-supervising PhD projects investigating word learning and autism. So our approach to researching this topic is theoretical and experimental in nature. What we do is we break down the process of how children learn a word into discrete mechanisms, and sometimes we analyze and investigate these individually, but sometimes as well, actually most of our research, we investigate how these mechanisms fit together in a holistic system. And what we seek to do is to try and identify factors that can influence the efficiency or success of these various word learning mechanisms. We're interested in different environmental factors concerning how we present information and stimuli to children, but we're also interested in how individual differences between children and characteristics can influence their learning. The population we focus on most is autistic children who have delayed language development. Variations in this delay, sometimes we work with minimally verbal children, and sometimes we work with children who have functional verbal skills, but are a bit delayed in relation to their chronological age. And the reason we focus on this population is because they will really benefit from the questions that we're trying to answer. And we draw comparisons against neurotypical children who are matched on receptive vocabulary. And the reason we choose receptive vocabulary as our matching criteria is that it reflects children's ability to learn new word-referent associations. So the number of words that children comprehend and understand, as opposed to the number of words that they produce. And this matching criteria is important because it allows us to study word learning in groups that are kind of on a level playing field in terms of language comprehension and word learning abilities concerned. And it enables us to explore whether autistic children are learning words differently based on expectations that are based on their language ability. Because if we were drawing comparisons with neurotypical children of the same chronological age, we know how that comparison will look. And usually the neurotypical children there'll be a difference there, but that's likely due to the neurotypical children of the same age just having superior language skills overall, or differences in nonverbal cognition perhaps. And that doesn't mean that the autistic children are learning words any differently than what we'd expect based on their level of language development. And really, we feel that this work is important because understanding the cognitive mechanisms underpinning how autistic children learn words is really necessary to inform practice and inform the design of educational resources and services. And we found this information to be useful for a range of practitioners, including speech and language therapists and teachers working in special education settings. So a bit of background, as I'm sure many of you are aware, lots of autistic children do have difficulty understanding and producing language. Some of these difficulties can be detected as early as 12 months of age, and they often endure throughout childhood. It's estimated that approximately 25 to 30% of autistic children are minimally verbal throughout childhood, and that means that they have 5 or fewer functional words in their expressive vocabulary. So difficulties understanding and producing language are a real challenge for this group of children. Although language learning difficulties aren't a core diagnostic criterion of autism, they are one of the characteristics that's first identified by parents, often leading them to seek autism assessments. And one of the reasons we focus on word learning particularly is that it seems like many autistic children who have difficulties learning language seem to have particular struggles with receptive vocabulary, more so than expressive vocabulary. And research has proposed that this is due to it being more difficult for children to understand the meaning of words rather than producing the form of words. So sometimes you'll find children who will say words that they don't understand, or they might repeat or imitate words like echolalia, for example. But really understanding the meaning of language can present a challenge. So what is word learning? What are we talking about here? Word learning involves a series of interrelated mechanisms that kind of work together in a system. So broadly speaking, it involves mapping a distinct sound pattern to a semantic meaning. And the first stage, once a child has detected a novel word in speech, is to figure out what it is that it refers to identify its meaning. And this process is actually quite challenging because children, when they're learning a language, they hear lots of unfamiliar words, often presented at a quite fast and rapid rate. And it might be that there's lots of unfamiliar things in the child's environment. So their job is to figure out what unfamiliar words map onto what unfamiliar objects in their environment. And children have lots of strategies that they use. And I'm going to be talking about some of these in the slides to come. So once a child has then figured out what a word refers to in their environment, it's then important that they store an association between the word and its meaning in memory for later retrieval. And if this doesn't occur, this storage process doesn't happen, then a child has to continually figure out what words refer to over and over again. Now, a third process is extension of meaning. Now, lots of the words that children learn, particularly in the early stages of building a vocabulary, refer to categories of things. They don't just refer to unique exemplars, they refer to lots of groups of things. And the child's challenge there is to figure out the rules that determine how a label can be generalized to unlabeled novel things in their environment, and what cues they should be paying attention to inform this process, and what cues they should be ignoring. So we'll start out by talking about how children identify meaning. So one of the ways that neurotypical children figure out what words refer to is by paying attention to social cues. So as speakers, we typically orientate ourselves towards the things that we're talking about. We look at those things, we point at them, we express emotion towards those things. Now, neurotypical infants are innately sensitive to these kinds of cues. They'll pay attention to them spontaneously, and they will orientate themselves towards whatever reference the speaker is referring to in their environment, and consequently will map novel labels onto the objects that they perceive a speaker is paying attention to and focusing on. And this finding was really nicely illustrated in a classic study by Baldwin. I've kind of crudely cartoonized the experimental procedure here on this slide. Essentially, you had an experimenter, a researcher, and a child, and they were each holding a novel object. And the researcher waited until the child was playing with their object and looking down at it before gazing down at the object that they themselves were holding and assigning it a novel label, Modi. The child was then tasked with identifying the referent for this novel word. Which of these two objects is the Modi? Now, the neurotypical children in this study, who were about 1.5 years of age, spontaneously consulted the speaker's direction of gaze. They followed their gaze to where they were looking and correctly mapped the word Modi onto the object that the experimenter was holding, the intended referent, rather than the object that the child themselves was holding. Now, we know that differences in sensitivity to social cues is a diagnosis-defining characteristic of autism. And early studies suggested that autistic children, due to their reduced sensitivity to social cues, this might be an explanation for why they struggle to acquire language in general. And this theory was backed up by findings that autistic children with language learning difficulties tend to map labels onto the objects that were the focus of their attention, rather than a speaker's intended reference. So using the same experimental setup as the Baldwin study I just described, Baron Cohen and colleagues found that autistic children with language learning difficulties mapped the novel label Modi onto the object that they themselves were looking at and paying attention to when they heard the novel word being uttered. So they didn't consult the speaker's direction of gaze, and as a result, mapped an inaccurate association between the word and an object. However, lots of recent research has shown and reported evidence to the contrary. Loads of recent studies show that autistic children are indeed sensitive to gaze and gestures when mapping novel word-referent relationships. And one of the there's a couple of reasons why this might be. It might speak to the effectiveness of early education in contemporary schooling, or it could be to do with differences in methodology. So in the Baron Cohen study, the social cue was really subtle. You know, the researcher just looking down whilst the child was occupied and paying attention and playing with a novel object that had been put in front of them. It's super easy for the child to miss that kind of social cue. And if they don't realize that it's happening, then they haven't really got a chance to utilize that cue in the service of their word learning. And in lots of the more contemporary research investigating this question, the social cues that we present to autistic children are a lot more attention-grabbing or a lot more salient, and we tend to ensure that children, our participants, are paying attention to them so that we can make a really informed conclusion about their ability to use these cues. And as a result, it's now widely agreed that autistic children can use social cues to inform their novel word-referent mapping, provided that these cues are salient and distractions are minimized. So we've got a couple of examples from a stimuli from our studies here, and you can see that the social cues are really obvious and much more salient to children than just a subtle direction of gaze change when children aren't paying attention. But some word learning situations that children find themselves in are really ambiguous, and they can't make use of social cues. So for example, on this slide, we have a situation where we've got two novel objects and we hear the word blicket. Now, at the moment, we just don't have enough information to know which of these is the blicket. We might be able to have a guess based on some kind of sound symbolism hypothesis, but we just don't know. Then we have another situation where we encounter the same two objects again, both previously in association with blicket, but now we hear the novel word zepper. So which is the blicket and which is the zepper? Again, we just don't know. And this is kind of characteristic of a situation that a young child might find themselves in, where they hear a novel word, but their environment is full of novel things. How is it that they're able to disambiguate which novel words map onto which novel reference? So, a third situation. This time we encounter a different pair of objects, one of which we've seen before in association with the word blicket. And this time, the word we hear again is blicket. So, if we've been keeping track of co-occurrences between words and the objects that they've been appearing with, we're able to deduce that this green spiky thing must be the blicket. And by extension, the red thing on the previous slides must be the zephyr. And we don't know yet what this yellow thing is. We haven't got enough information. And this kind of learning is a process known as cross-situational learning. And it's essentially just keeping track of pairings between objects and the things that they co-occur with over multiple individually ambiguous exposures. But by keeping track of these co-occurrences, we're able to reliably figure out which words go with which objects. And neurotypical children are really good at this. From as early as 12 months of age, they can accurately disambiguate word meanings using cross-situational learning. Now, thinking about autism, the evidence suggests that autistic children's cross-situational word learning accuracy doesn't differ from neurotypical children's when expectations are based on children's language skills, suggesting then that the mechanisms underpinning cross-situational word learning don't differ. That being said, we find that autistic children are slower to identify correct reference via this type of learning than neurotypical children matched on receptive vocabulary. And this has important implications for how children might learn words in naturalistic settings. So in our experiments and our studies, we present stimuli at a nice, fairly slow pace, and children's progression through the trials is dependent on their speed of how quickly they themselves respond. So they've kind of got unrestricted opportunity to look at the stimuli and process it and formulate a response. By contrast, in a naturalistic setting, words are presented at about 150 words per minute, so much faster. And there's often far more distractions and things vying for their attention. So it might be that the rate at which speech is presented in naturalistic settings presents a kind of a processing bottleneck for some autistic children that can then impact on their ability to keep track of which words go with which objects over multiple encounters. We also find that autistic children's cross-situational learning accuracy is predicted by their receptive vocabulary. So those children who have the most severe language learning difficulties seem to struggle with this the most. And it might well be the case that this is one of the contributing factors to why they're struggling to acquire vocabulary, is this ability to keep track of associations between words and objects across multiple situations. Now, another way that children identify the meanings of novel words is through their existing understanding of how language works. So as children learn the meanings for more and more words, they abstract these kind of rules and assumptions as to how language, how kind of word-object pairings function. And one of these principles, these rules that they abstract, is known as mutual exclusivity. And this is the idea that each word only maps onto one object. So each object only has one name. So when a child experiences a novel object that they're unfamiliar with, and they hear it in co-occurrence with the novel word, but there's lots of other familiar things that they have labels for in their environment, they, through a process of elimination, apply this mutual exclusivity principle to map a novel word onto an unfamiliar, unlabeled object. So an example of how this might work is on this slide. A child hears the phrase, "look, an okapi." And at the time when they hear this, they see these three animals. And through process of elimination, they know that it can't be the animal on the left because it's a cat. So if it's a cat, it can't also be an okapi. And the same is true for the animal on the right. It's a dog, and if it's a dog, it can't be an okapi. So by applying mutual exclusivity, the child correctly identifies that the unfamiliar object is the okapi. Now, one of the most consistent findings across word learning literature investigating autism particularly is that autistic children reliably apply mutual exclusivity when identifying reference from familiar words. And this finding has been documented across a range of children with really varied language learning abilities, including minimally verbal children, including children who have language skills commensurate with their chronological age and development. And we find that use of mutual exclusivity predicts children's receptive vocabulary development. So those children that use mutual exclusivity more reliably, more frequently in novel word learning situations are those who typically have larger receptive vocabularies. And that suggests then that this is a strategy that could be really important for autistic children in figuring out what words refer to and in building their vocabulary. Now, this might be a valuable strategy, but it's not without its limitations. So it's limited, of course, by children's existing knowledge of word meanings. So if a child has a smaller receptive vocabulary, there'll be fewer situations in which they're able to actually apply this strategy to figure out the meanings of words, because there are just more unfamiliar things in their environment they haven't got labels for. But on the flip side, as a child's receptive vocabulary increases in size, there are more opportunities for them to apply the strategy effectively. Also, the effectiveness of mutual exclusivity is contingent on children's attention. They have to be able to analyze and kind of look at lots of things that are in their environment. And in addition to identifying what the correct reference for a novel word is, they have to be able to exclude competitors. And it might be that if a child has a really strong attentional preference for certain objects in their environment, that they fixate on those, they focus on them, and they struggle to disengage. So it might be that they don't notice some of the objects in their environment that would enable them to apply this strategy. So thinking practically, research has shown that autistic children with language learning delays can accurately identify novel word meanings when stimuli are presented in favorable ways. And this speaks to, I think this is a really important and positive message, because it suggests that vocabulary acquisition can be scaffolded if we optimize autistic children's environment, if we present information in the right way that enables them to utilize their strengths and strategies that they're able to employ. It may be, however, that autistic children require a bit more time to process language, and that this may have implications for word learning in naturalistic settings, particularly when there's lots of distractions and speech is presented really rapidly and children don't have enough time to process and figure out what words refer to. So it might be that they are able to apply these strategies in situations that are controlled, but when things speed up, it could be a bit more difficult. So what we feel like, and our feeling is that autistic children likely benefit from environments that enable them to utilize strategies that are really positive for them, utilizing their existing vocabulary knowledge, learning at their own pace, minimizing distractions, and providing really salient attentional cues. So moving on to storing of meaning. So we'll start with a really important question. If a child has identified the meaning of a word successfully, does this mean that they've actually learned that word? Has it entered their vocabulary? And the short answer is, unfortunately, no. So we know from loads of research with neurotypical children that 2-year-olds forget words almost as quick as they figure out their meanings. They can do really, really well in tasks where they, say, apply mutual exclusivity to identify the meanings of novel words. But then we test their retention after just 5 minutes, and it's as if they have never encountered these words before. They've completely forgotten what they mean. And what this tells us is that figuring out what a word means in the moment that it's heard isn't sufficient to support long-term learning. And the reason for this is that identification of meaning and retention of meaning are two separable but related processes. Identification of meaning is really an attentional process. It's about children focusing on the right things at the right times in a naming event when they hear an unfamiliar word. Whereas retention is more about building associations in memory over time. And this is demonstrated by evidence showing that retention following cross-situational learning is much more accurate than retention following fast mapping. So fast mapping is when a child uses cues in their environment such as mutual exclusivity or social cues, to really rapidly figure out what a word refers to. Whereas, of course, cross-situational learning is this repeated tracking of word reference associations over multiple exposures. And this tells us that it is this repetition, this keeping track of what words refer to over multiple encounters that really supports and drives retention of novel word meanings. Research also shows that how we present information at the initial stage, how we show objects and present language to children when they're identifying meaning, can influence the likelihood of their successful retention. So when we think about word learning for autistic children, the vast majority of research is actually kind of fixated on challenges associated with identifying meaning. And one of the objectives in our lab really is to extend the focus beyond identification of meaning to also include retention. And this is important because really retention is what reflects true learning. As we've shown on the previous slide, figuring out what a word refers to isn't the same as actually remembering what it means and being able to retrieve that after a delay. So over the next few slides, I'm going to talk about a series of studies that investigated autistic children's ability to retain novel words. So in the first one, we taught autistic children with difficulties learning language a series of novel words using mutual exclusivity. And what we found was that they were just as accurate as neurotypical children matched on receptive vocabulary when their retention was tested after 5 minutes. So what this tells us is that the relationship between these identification and retention mechanisms for autistic children, it doesn't differ. Effectively, once the information successfully enters in terms of identification of meaning and a word meaning has been figured out, the likelihood of retaining that is just the same as for a neurotypical child with similar language ability. And we also found in this study that autistic children's retention can be enhanced by providing highly salient social cues that redirected children's attention to reference after they'd figured out the meanings of words for themselves. So initially, they used mutual exclusivity to actively identify a word meaning. And then after they'd made their word referent mapping, the researcher essentially provided social feedback. They ostensibly labeled the intended referent. They clearly pointed at it, they directed the gaze towards it, and relabeled it. And what we found was that this reinforcing feedback that autistic children really paid attention to led to a significant enhancement in the likelihood of retaining words after 5 minutes. So in a really recent study that we just had accepted last week, first study published by my PhD student, Charlotte Rothwell, she was interested in how children's differing attention to stimuli and their interests, the preferential interests, might influence autistic children's word learning. So we know that autism is characterized by restricted and repetitive interests and behaviors. So the way in which they attend to things in their environment can differ. It might be there are certain categories of things that they really pay a lot of attention to, and as a result, they might pay less attention to other things. And this is the question at the heart of this study. So we, using mutual exclusivity again, we taught autistic children and neurotypical children with similar receptive vocabulary skills names for objects that were high interest, but also names for objects that were of neutral interest or didn't really align with children's preferential interests. So the high interest stimuli were novel animals. And we know that neurotypical and autistic children often really like animals. And we confirmed this in this study in advance. So all of our participants, we knew that they were keen on animals. And the neutral interest stimuli were just novel objects. So these are generic experimental stimuli that are pretty typical across research in this discipline. And what we found was that when we tested retention after 5 minutes, autistic children retained novel words associated with the high interest stimuli of these novel animals with significantly greater accuracy than neurotypical children with similar language abilities. It may have been that their enhanced interest in these particular category led to them focusing and encoding more information about the reference, leading to these kind of more robust memory representations that were less likely to degrade over the 5-minute wait. Now, also really interestingly, we found that autistic children's retention of words associated with the neutral interest stimuli substantially increased after a night's sleep. So we tested retention not just after 5 minutes, but after 24 hours after they'd been to bed overnight. And the fact that retention for these kind of less interesting words increased, that suggests that the consolidation effect of sleep. And so we know from studies of neurotypical development that sleep is really important for language development. It plays this kind of consolidatory role where when you go to sleep, novel memories are kind of reactivated while you're asleep. So these novel names associated with the neutral interest stimuli, we kind of hypothesize that they're perhaps more fragile because the children perhaps pay less attention. And as a result, they actually benefited more from this overnight consolidation. Now, we also found that autistic children were slower to respond than neurotypical children. And this might signal a speed-accuracy trade-off. Again, it speaks to the idea that when they're given time to learn at their own pace and to engage and analyze the kind of stimuli that we present, they're really effective in their learning. But the implication is that if this then speeds up, it's possible that they might have some more difficulties. So in a third study, again, one of our brilliant PhD students, Cheriece Carter, was interested in how autistic children learn from different kinds of pictures. So pictures, of course, are really important as an educational resource in both mainstream and special education. Pictures are really vital as a symbolic medium because they enable children to learn about things without direct experience. And they can be particularly important for some autistic children who are minimally verbal, who are maybe taught to communicate using pictures instead of words via augmentative and alternative communication systems, like the picture exchange communication system, for example. But the kinds of pictures that are used in educational and clinical contexts vary quite dramatically in terms of their iconicity. So iconicity is the extent to which a picture resembles the thing that it's supposed to represent. The theories of symbolic development state that the closer kind of a symbol resembles the thing it's supposed to refer to, the more transparent it is. The easier it is for children to figure out relationships between the symbol and the thing it refers to in the world. So what we did in this study is we taught autistic and neurotypical children names for novel objects depicted in black and white line drawings or color photographs. And what we found was that after 5 minutes, autistic children retained words more accurately when they were taught via color photographs than the black and white cartoons. So this suggests to us that children's word learning is influenced by iconicity, and that the greater detail presented in a color photograph provides benefits for autistic children's memory, encoding, and extension to symbolized objects. That greater transparency enabled them to facilitated their ability to figure out what these pictures referred to when we tested their extension to symbolized 3D reference. We've also looked at how autistic children learn words through cross-situational learning. So in this study, autistic children retain novel words by tracking word-object associations just as accurately as neurotypical children matched on receptive vocabulary. However, they were significantly slower to both identify and successfully retrieve, after 5 minutes, the correct meanings for these words, again, indicating this increased processing time. However, we also found a really interesting finding that by providing these really salient attentional cues of both social and non-social in nature, this accelerated autistic children's ability to map novel word-referent relationships, but it wasn't at all detrimental to their attention. So essentially, we made the process of cross-situational learning quite a bit easier by indicating what the correct referent for each novel word was on every trial. And you might think, oh, well, one option potentially was that by making the task easier, children were putting less cognitive effort into it, and that then might actually negatively impact their attention. But that's not what we found. We found that it simply sped things up. They were much quicker to identify correct reference, and then they retained these words just as well. So it might be that providing salient social cues at this early mapping stage is just really useful, providing that children are able to pay attention to them and make use of them. And again, what was interesting here is that we didn't actually tell children to pay attention to these cues. And that surprised us potentially with the social cues. The autistic children just spontaneously paid attention to them, provided that, because it was so salient and it was visible to them, they just spontaneously used it, which again kind of is counter to the classic Baron-Cohen et al. Type findings. So thinking practically, across all of these studies, we show that if autistic children are able to actively identify new word meanings, they're just as likely to retain them as vocabulary-matched neurotypical children. So one of the features that's consistent across all of our studies is that we kind of get children to figure out the meanings of words for themselves. They're not passive learners. We don't kind of ostensibly label things in the first instance, and that is how children figure out word meanings. We allow children to figure the words out for themselves by employing strategies like mutual exclusivity, like cross-situational learning. And this might actually be one of the reasons they do really well in our studies, because they're able to figure things out for themselves. We also show that the kind of stimuli that we present to children during teaching does influence the likelihood of their attention. And again, this speaks to the possibility that if we present stimuli in the right way, if we're able to optimize autistic children's environment, then they can be successful in acquiring new vocabulary. An exciting finding in Charlotte's study was that sleep consolidates word referent associations in autistic children's memory. But we know that autism is often characterized by differences and disturbances in sleep. So a valuable next step would be to investigate in more detail how individual differences in sleep quality, duration, and routine might predict word learning ability and vocabulary development over time. And also, consistent across these studies, we find that allowing autistic children to learn and respond at their own pace might well be key to them, their accurate attention in our studies. And that if that has that implication I've been talking about learning in naturalistic settings, which are vastly more abstracting, where speech is presented at a much more rapid rate. So finally, we're going to think about extension of meaning. So flexible use of language not only involves identification, retention of meaning, but also generalization of words across contexts. So lots of the words that children first acquire, particularly the early words in their vocabulary, refer to categories of things. They're basic level nouns, and they don't just refer to specific things, but groups of things. So it might be that a child first learns the word dog in relation to their family pet at home, but to understand its meaning, they need to realize that it can be generalized to a whole range of other things in the environment that actually differ quite a bit in terms of their perceptual features. And the child's job is to identify what perceptual features determine accurate generalization and which features they can ignore. So Linda Smith and colleagues have done lots of research on how neurotypical children effectively learn accurate generalization. And again, it's through developing a lexical heuristic, an assumption about how language works, known as the shape bias. And this is illustrated, this process of learning the shape bias, on this by this diagram that I borrowed from Smith et al. 2002, and it divides into 4 steps. So at the first step, children map individual relationships between words and objects. So they'll map the same word onto lots of different members of that category in their environment. So they might map the word cup onto a green cup, a blue cup, a red cup. And these are all individual word referent mappings at this point. Then, as children map the same word onto more members of the same category, they come to realize that objects that share the same label have certain perceptual similarities. Cups are cup-shaped, balls are round. Then, once children have enough of these category labels in their vocabulary, between 50 and 150 count nouns at around 2 years of age, they kind of realize this general purpose rule that the shape of a thing determines what it is, and therefore the label it should receive. So if balls are round and cups are cup-shaped, then X's are X-shaped. Upon this realization that shape determines the label a thing should receive, this is really when the shape bias emerges, and children start applying this to novel word learning situations. So for example, they might learn the word giraffe in association with a real giraffe at the zoo, but then spontaneously extend the word giraffe to like a plush toy giraffe when they get to the gift shop at the end. By thinking about autism, we know that many autistic children do struggle to generalize information and behaviors across contexts. This is one of the challenges that practitioners often face. And this difficulty can manifest as well in the extension of novel labels to words, to reference, sorry. Now, kind of like retention, there hasn't been so much research investigating generalization of labels in autism by contrast to identification of meaning. And what evidence there is kind of mixed. So some evidence shows that despite autistic children possessing expressive vocabularies exceeding 100 concrete nouns, so more than you would the kind of the threshold that you would expect a neurotypical child to be showing the shape bias, autistic children still aren't showing this preferential attention to shape when generalizing labels. In one of our early studies, we found that minimally verbal autistic children were just as likely to extend labels to pictures and objects based on color, just as frequently as shape. So color is a category irrelevant cue. It doesn't usually determine what a thing is or the label it should receive. So they were generalizing just as frequently based on an inaccurate cue as they were correctly based on shape. And it's been suggested that the absence of a shape bias in autism might be linked to differences in how autistic children are perceiving the world and the information that they are paying attention to. So differences in categorization and prototype formation, for example. However, other studies have found contradictory evidence. Typical shape bias based label extension has been observed in autistic children with unimpaired language development, and also in children who have difficulties learning language, but at much older kind of language age equivalent or mental age than you would expect to see in neurotypical children. So it might be that they show the shape bias once their language ability exceeds 4.5 years, so quite a bit more advanced than the 2 years that you'd expect to see the shape bias in neurotypical development. We've also found in our studies that generalization from memory after 5 minutes doesn't differ in comparison to vocabulary matched neurotypical children, which suggests then that it might be something about online categorization and comparison of stimuli that might be causing autistic children problems. Because when we're asking them to generalize based on their memory, they've clearly encoded the right information that facilitates shape-based label extension. So it might be that the development of the shape bias is just delayed rather than being different. An alternative possibility that we've recently investigated in Leigh Keating's PhD is that whether or not autistic children show a shape bias ultimately depends on what they're asked to do. And Leigh's findings are absolutely fascinating and really actually support this hypothesis. Across, she taught autistic children new words in various different experimental methodologies that kind of map all to the differences that you see in previous research. And what Leigh found was that autistic children reliably generalize based on shape in forced choice tasks, but not yes-no tasks. So we've got visual examples of these kinds of tasks on this slide. A forced choice example is when you present two alternatives and you say, which is the referent for a novel word? So having been taught that this red object is a zepper, and then you show them a blue thing, and then a color match belonging to a different object category, autistic children really reliably will select the blue thing. So essentially they're being asked, which is the most zepper of the two? And in which case, they do prefer to generalize based on shape. Whereas a yes-no task involves presenting objects individually, and the child has to make a decision on each one. Is this a zepper? Yes, no. And this actually requires more a category exclusion decision. They have to not only decide if something is a zepper, but they also have to decide if something isn't a zepper. And this seems to be where autistic children differ in their generalization of labels. It might be that the boundaries between categories are a bit more fuzzy and that they're perhaps a bit less confident in really using shape as the determinant of category boundaries. So thinking practically again, it might be that autistic children just need to acquire a larger vocabulary than neurotypical children before they develop a shape bias. It might be that they just need more information before they figure out that shape is really critical to word referent associations. It might also be that the shape-based generalization depends very much on what autistic children are asked to do in any given situation. Are they asked to identify from a selection which is the zepper, or are they using this category exclusion inclusion type task? Yes, no. it may be possible, thinking kind of a bit outside the box, to accelerate autistic children's learning the shape bias through training with multiple exemplars. And the reason we think this might be possible is because of work with really young neurotypical children. And we've shown, this research has shown that if you teach young neurotypical children younger than 2 years of age, a novel word associated with lots of different category members, differently colored members of the same category, this seems to essentially tune their attention to shape. And this leads to an early development of shape bias and accelerates vocabulary development. Now, I don't believe any research has investigated whether this training of multiple exemplars can benefit autistic children, but it's a study that I really want to do in the near future. So finally, the last study I'd like to talk about is a meta-analysis being conducted by Sophie Lund and Charlotte Rothwell, a PhD students. And this is an absolutely terrific endeavor. They have analyzed data across all studies investigating word learning in children who are autistic, published until June 2021. And they analyzed data for over 1,200 autistic children and over 1,500 neurotypical children. So across all the literature, this meta-analysis shows that autistic children's identification of word meanings is less accurate than neurotypical children's, but their attention and generalization isn't. And again, this speaks to the idea that it might be that autistic children might struggle sometimes to figure out what a word actually refers to. But once that's then figured out, differences, they don't seem to differ in retention and generalization. So it might be that really optimizing environment and presenting information in a way that appeals to autistic children's strength is really critical, because once that's then been encoded, vocabulary acquisition appears to kind of transition as you'd expect in neurotypical development. Also, really interestingly, this meta-analysis showed that differences between autistic and neurotypical children are mediated by environmental factors and participant characteristics. For example, the difference between these groups was smaller when these word learning tasks were administered via screen-based technology using computers or tablets rather than in-person social interactions. And we also find that participant characteristics like receptive vocabulary were really important. The larger an autistic child's receptive vocabulary, the less likely they were to differ in terms of their word learning ability. So finally, just to conclude, across all of these studies, we find that when expectations are based on autistic children's language abilities, they can often learn new words just as accurately as neurotypical children when information are presented really favorably, when environments are optimized to appeal to their strengths. We find that autistic children's word learning mechanisms and the relationship between them are not qualitatively different. Essentially, autistic children have the same strategies for figuring out what words mean and retaining words and generalizing words as neurotypical children. So they're not learning words any differently. And where we do find differences quite consistently is in the speed at which they're able to respond. So autism might affect the rate at which children are able to process information, which does have implications for naturalistic learning. And for us, figuring out these environmental conditions that can really promote and optimize autistic children's learning is a current and long-term objective. It's really important for us in the next stage of this research program to directly implement some of these findings into practical service. So thank you all for listening. I really appreciate your time and of course welcome any questions either now or if you'd like to email me afterwards, that's fine too.
Thank you very much, Calum, for sharing your work. It was really interesting to hear. We'll now move on to the question and answers. We've already had some really interesting questions. If anyone has any more questions, please add them to the Q&A function at the bottom of the screen. So Ruth has asked, does word learning processes relate to gestalt language processing and natural language acquisition?
Oh, good question. Can you run that past me again?
Yeah, so does word learning processes relate to gestalt language processing and natural language acquisition?
Yeah. So in relation to the second part, certainly word learning processes, whilst we investigate those in controlled settings in our kind of research studies, essentially these are processes that directly map onto how children acquire words naturalistically. And we're just exploring them in a more constrained setting. And I suppose the point of that really is to, once we know how children are learned, kind of really understand the mechanisms that support children's disambiguation, retention, generalization of word meanings, we can then explore and translate them in more naturalistic learning. And in fact, actually, that's one of the next steps of this research program that I'd really love to do, and investigate how children's sensory experiences within naturalistic language learning situations predicts their ability to learn words. So directly mapping these mechanisms onto real world learning. And again, the Gestalt processing is an interesting one. Not something I've personally thought a great deal about, to be honest, but I believe so. I mean, it's very much about how we perceive the world. And we know sort of kind of computational models of word learning and neurotypical development highlight the importance of sensory input. So what we intake from our environment feeds into then what we learn about it and how we map novel word referent relationships. So if you're perceiving the world differently, then that might well have have implications for your ability to learn novel words and what it is your kind of representation of word meaning actually relates to. So yeah, I hope that kind of answers your question in part. I say it's not, you've got me on the spot right for that one.
Thanks for that, Calum. Okay, so Vivian has asked, is there any differences found between autistic children's acquisition of nouns and other types of words, such as verbs?
Oh yeah, fabulous question. I think the answer to that is as yet unknown, basically. Almost exclusively research investigating how autistic children learn words has focused on nouns. And there are important reasons for that. I think I mentioned earlier we focus on nouns because they're the sort of the building blocks of an early vocabulary. But verbs are also super important. They're just a bit less frequent in children's vocabulary. And they're also harder to investigate. But that doesn't mean that we shouldn't do so. And that, again, we're only sort of on the brink of the iceberg, if you like, in terms of investigating this topic. And we're doing tons of work on it. And exploring verbs and objectives and other kinds of word categories is another next step. My feeling is that some of the strategies that would be employed for learning nouns might generalize across. For example, cross-situational learning, and I suspect that will probably play a part. But one of the challenges with verbs, I guess, is that there isn't something concrete necessarily to visually fixate on. And it's harder to abstract rules, I think. But there are sensory motor components to it that, again, might help with learning, perhaps. So, again, super question and something that I hope to answer in a couple of years' time, I guess.
It sounds exciting, much more research to get involved in. So Zoe has asked what the key takeaways you would say there are for mainstream settings to be aware of for aiding word learning with autistic children.
Yeah, I think the main takeaways that seem to kind of reoccur across our work is that novel vocabulary acquisition for autistic children really benefits from how we present stimuli. So if we present stimuli in a way that allows them to independently and actively figure out word meanings, then retention seems to follow on naturally and seems to, it seems to be just what you'd expect based on their language abilities, really. There's nothing different. So if we can use knowledge of how autistic children are able to learn words effectively, such as taking advantage of their existing knowledge of language using mutual exclusivity, presenting attentional cues in a way that's really salient, that's really obvious, giving children time to process. So not presenting language too quickly, not expecting responses too quickly, and also potentially capitalizing on their interests as well. One of the research questions that we haven't been able to address in Charlotte's PhD, but we actually plan to. But Charlotte did a brilliant job because she was conducting her research and then COVID came along, basically just halted everything. But one of the studies we wanted to do was to see whether we could kind of bootstrap autistic children's learning of kind of non-interest things based on things they're interested in. So if we could take, say, an interest in animals and situate learning about other things within that interest, if that would then kind of have a generalizable effect. So there's still lots to be done. Oh, sorry, Hayley, I think you're on mute.
I am. Thank you for letting me know. So we are limited today for time to talk about this very important topic. We have captured all of your questions and we'll ask Calum to answer them after the webinar is finished. Thanks so much, Calum, for all of the questions you have answered.
Thank you.
And they really do allow us to dig deeper into what our speaker has been sharing and help us all understand even more. On our website, you can sign up to the Autistica network, where you'll hear about our future webinars and the latest in autism research, including how you can get involved. I wanted to say a big thanks to Mercedes, our digital marketing and events manager at Autistica, who has organised this webinar, and to members of Austica's science team, Michelle and Amanda, for supporting today. And of course, a huge thank you to Calum for sharing their work with us today and for answering your questions so thoughtfully. It's been an absolute pleasure having you with us. Thank you so much.